Hello and welcome to this evening's webinar where I'm going to discuss Candida, which is yeast overgrowth. My name is Brianna Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And today we are going to discuss a topic that is 100% relevant to everybody, which is not always the case when we do these webinars. And I'm going to give you some insight into some very relevant ways that Candida overgrowth, which we're going to get into what that is very relevant post-pandemic. And it's not initially what I wanted to discuss or had intended on including in this webinar, but I want you to stay tuned because I'm going to be presenting some information that I have experienced personally, that I see my patients experience, that I see often get missed in physicians' offices, and then of course, what we can do about it. So I'm going to go ahead and share my screen and we're going to get started. As I mentioned in the chat, if you have questions, please be sure to drop your questions in the chat. I will address them after I finish presenting and open up the floor for questions. So as I mentioned, I am one of the pharmacists at Physicians Preference Pharmacy, and especially as this relates to guests of the Hotze Health and Wellness Center or those that are curious about coming on or using our pharmacy, a staple of what we do and we focus on with all of our guests is yeast overgrowth. Now, the type of yeast I'm going to be talking about particularly is Candida. Of course, I always like to start with a brief background of who we are, what we believe, and why we're different, because as a compounding pharmacy, we know that there are a lot of different opportunities out there for you to seek different pharmacies. We love that you're with us. We love that you have interest in being with us. And so I want to give you a little bit of insight into who we are. So we believe that prescription drugs, yes, even pharmacists believe that prescription drugs are commonly overprescribed. Honestly, much of the time only treating symptoms without addressing the underlying condition. So we take a root cause approach. When we talk about gut health tonight, when we talk about Candida overgrowth tonight, we are addressing a root cause condition. We primarily specialize in BHRT, which is bioidentical hormone replacement therapy. That's kind of our baby. It was our bread and butter, how we got started. Many years ago, we expanded into specializing in peptide therapy, immune modulating compounds, and much of what we do today supports the immune system and the hormonal systems as well. Of course, we always focus on the gut, which is what we'll be focusing on this evening. Of course, all of our preparations are always free of unnecessary dyes, binders, fillers, artificial sweeteners. We still get a lot of calls if we have gluten in our preparations, if we use lactose in our preparations. No, we don't do any of that. And we also have paraben-free formulations as well. So especially because we specialize in bioidentical hormone replacement therapy, it's very counterintuitive to put any ingredients in the preparation that would be disrupting your hormones. We ship to 49 states, and actually this PowerPoint was finished up last week. As of today, May 1, this becomes 48 states. So that excludes Alabama and Minnesota. If you're located in Alabama or you have family members in Alabama and you use our pharmacy, you may know that we still have guests there. What this means is that we just can't ship directly into that state, and the same goes for Minnesota, probably until about the beginning of the year. What we are seeing is that many states are changing their regulations basically on a dime, requiring that not only pharmacies be licensed, but pharmacists be licensed. So for us to be able to serve the entire nation or most of these states, we have several pharmacists on staff with multi-state licensure that allow us to be able to ship directly into those states. So since those states have made those changes, we need to pivot, we need to take the exam. And of course, that takes time to study for the exam, to take the exam, to pass the exam, and then be able to ship into those states again. Our turnaround time, we are hearing, unfortunately, from a lot of other people using other pharmacies, that the turnaround time or the time to get your prescriptions has really become lengthened. It is not uncommon for me to hear that it takes 1 to 2 weeks. So I think it's important to point out that our turnaround time is 1 to 2 days, which is much more fast, of course, but also important if you've got something that is a more crucial medication and not something that's just considered maintenance. We are PCAB accredited, and I always think it's important to include this because this is a voluntary accreditation that we seek and that we have held for several years. So as a compounding pharmacy, we do answer to the state boards of pharmacy. However, we take it upon ourselves to get PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, which essentially means if the state boards tell us that we can do X, Y, Z, then we do that better. We have more stringent standards, and we have standard operating procedures behind the closed doors that we follow to be sure that we get consistent compounded products to you month after month. Also, we do weight testing on site, and we send out several samples per month by each compounding technician to a third-party laboratory to verify that our processes and our compounds are excellent and meet our expectations and specs every single time. And if not, then we pitch it out. All right, so we are going to slide into Candida overgrowth and talk about what that is. But first, I want to identify the larger problem for you, because we definitely have one. I see a lot of people walking around with all of these symptoms. Sometimes people just have a few, but it's not uncommon when guests come to us initially to have all of these symptoms. I would say that the bloating, the gas, abdominal discomfort, sugar cravings, and mood fluctuations probably are the most common, but we are seeing more and more people show up with this list of symptoms, including indigestion, increased food allergies, some very sensitive individuals to chemicals, not just cleaning chemicals, chemicals in food, people that say they're quote unquote allergic to water. We know that that's largely related to the chemicals in water, skin issues, brain fog, oral thrush. So that white looking growth on the tongue, that's oral thrush or candidiasis, Candida overgrowth in the mouth. And then also weight gain, of course, always a very relevant one. So for us to discuss what candidiasis is, before I get into that and define it, I want to give you the 30,000-foot view. So as functional medicine, healthcare professionals, we are taking a whole body approach when we look at the overall health, not just from a reactive approach, but a proactive approach in our guests. So something we don't always talk about, we still are very siloed in the medical field, is we have our dentists over here. We've got our endocrinologists over here. We've got our primary care physicians over here, and the list goes on as far as specialty goes. But this is an important topic because something you do every day is you eat. And one of the aspects of our health that we have a lot of control over really is what goes in the mouth. So health does start in the mouth. It is largely to do with nutrition. And then there are a lot of things that happen between you forking food into your mouth and you going to the restroom. And so when we look at that process, I'm about to break it down for you. We know that health starts in the mouth, and largely it manifests in the gut. That's pretty obvious because obviously the food goes through the gut. But when we take a root cause approach, we need to look at the foods. We need to have an evaluation of oral hygiene products. So what are you using in your mouth? Stress is a major one. A lot of people will have bad breath, right? When they get really stressed out, where's that coming from? It's largely coming from the gut and coming upwards. And then also dental hygiene routine. So it's not uncommon to go to a general dentist and they're going to recommend fluoride treatments. They're going to recommend a fluoride treatment in office, most likely. They're going to recommend toothpaste with fluoride in it. They're going to recommend mouthwashes, and the list goes on, truthfully. Now, what we want to be aware of is that we are not disturbing the oral microbiome. We talk a lot about the gut microbiome, which basically just means the environment of the gut terrain, what is going on in there. We know we have a lot of bacteria in there. We know we have good bacteria and bad bacteria, right? But we have the same in the mouth, and it's all about balance. So to really oversimplify what happens, again, when you fork food in your mouth and you use the restroom and it comes out the other side, that is one tube. And so there's a lot that can happen in there. We don't want to disrupt it at the beginning, which is the mouth. We don't want to disrupt it in the middle, which is digestion through the stomach or through the colon, the small and large intestine. And then also we don't want to disrupt it at the end in the colon. So keep that in mind that we have several phases of digestion, and some of the products that we're going to talk about that address fungal overgrowth in the body happen at all those stages, but it starts right here. All right, so first thing, we look at the root cause. Second thing that we do is we deplete the gut of the junk that just simply should not be in there, and also deplete it of anything that can be causing fungal overgrowth. I'm going to talk to you about the yeast-free elimination diet. If you're already a guest of ours, then you know that we do a big push pretty much every January to bring everyone onto the same page, because everyone's super motivated at the beginning of the year to make changes. And so we will do a yeast-free cleanse, or pulling high yeast foods out of the diet for a few months, depending on kind of where that person is at and what their symptoms are, because we have to remove the offending agents and then usually use antifungal medications. We can also use supplements too, as a blend, to be sure that we're killing off any excess yeast overgrowth in the gut. Number 3, we want to replete. So your gut and your GI tract, mouth to anus, is like a garden. When you want a healthy garden, you have to weed it out, but then you also fertilize it, and that is the repletion phase. So with that, we use probiotics. We want to repair the tissue in the GI tract. And then a big part of what we do are also using peptides. So we like peptide therapy for this. All right, so we came here to talk about yeast overgrowth, aka candidiasis, aka Candida overgrowth. So what is Candida? Candidiasis itself is a fungal infection or a yeast infection caused by Candida overgrowth. So Candida is something that lives, again, mouth to anus. It also lives all over your skin. There's different types of Candidas. We're talking about the one that's the most relevant, which is Candida albicans. Now, again, Candida albicans lives everywhere. It is very prevalent in the mouth, the throat, the gut, the vaginal tract, but in excess, it can lead to systemic, or basically all the way throughout the blood, Candida overgrowth, which is what we call candidiasis. Now, oftentimes when we think of a quote unquote yeast infection, we will think of a female vaginal yeast infection. This still falls into the same category, but we're still talking about yeast. This candidiasis may cause major problems, which we oftentimes see get misdiagnosed and something else. And the problem here is that if someone has bloating, or they have anxiety or depression, then sometimes the prescriber or the physician will not identify that this is linked to the gut, especially if it's mood related. Anxiety, depression, for example, we all know what kind of prescription you're likely to walk out of the office with is an antidepressant. What does an antidepressant do? It knocks the immune system out of balance. It does not fix the root cause problem. We have a lot of sexual side effects, and oftentimes we'll see weight gain. So we're actually regressing and going in the other direction. Again, as one of the pharmacists, but also in my main role as the physician liaison, what I do is I spend a lot of time in outside prescribers' offices, really all over the country, because we have prescribers everywhere that fill prescriptions with physician's preference pharmacy. And it is very uncommon that I go into one that has already implemented this into their practice. So it's a very easy way to help people without having to do too much, quite frankly. We're just getting back to basics of treating the gut. So we don't want to mask the problem. The gut can recurrently become affected by Candida albicans opportunistic infection. Opportunistic sounds good, right? Well, in medical terms, what we mean when we're talking about opportunistic infection is, again, think about a garden. You're always going to have some sort of weeds or small little guys that may be cropping up. You're going to have your flowers, you're going to have your vegetables, and they're all competing because they are all sharing that ecosystem within the soil for nutrients and nourishment and light. And some of them need to grow wider, some of them need to grow taller. Basically, they all need to coexist. But if you have one bully in the garden, it is going to take over. And so usually when we see, I'll say one of the most common reasons that we see candidiasis or yeast overgrowth is after someone takes a round of antibiotics. Because when you take antibiotics, as we know, it wipes everything clean, all the good, all the bad. And so when that happens, Candida goes, awesome, cool. I can take over everything now. I'm just going to overgrow. All the good bacteria that was there before was keeping me at bay, but now I'm going to go to town and just infect the whole gut. And we see this all the time. So this is why we have to deplete it out and then replete the gut back with what we need to nourish it. Again, taking a root cause approach. So I briefly just touched on this, but some contributing factors that we see to disturbing the mouth and the gut environments are stress. Stress leads to inflammation. We talked about foods. So we are seeing a lot of changes right now in what is going to be allowed and not allowed into our food supply. So I'm very interested to see where this will go. But if we follow the modern American diet or the standard American diet, which is generally high in processed foods, essentially dead food, high carbohydrates, and high fats, then we will get, again, stress on the body, inflammation, and we get disruption of the gut microbiome. Now, killing off intended and protective oral microbiome, that comes from where? Antibiotics. Poor oral hygiene, so that can be anything from not going to the dentist as often as you should, or you may be over cleaning, essentially, stripping the good microbes in the mouth with mouthwash and with other types of toothpaste that basically just strip it clean, not leaving the good, healthy bacteria in there. Also, of course, if you neglect to go to the dentist and you're not brushing appropriately, also, you're going to get buildup of bacteria, which is going to cause inflammation. And we know that that is a direct avenue to our systemic system, AKA our blood system. Now, if you didn't know this, if you've used antibiotics in the past 90 days, you're technically considered immunocompromised. So we usually think of someone with cancer or HIV or someone who is pregnant. Those all qualify as immunocompromised people. But also if you've taken antibiotics in the last 90 days, then so are you. So we need to correct that. Candida albicans overgrowth symptoms that need to be addressed are leaky gut, allergies, immune disturbances, weight gain, headaches, brain fog, skin rashes, and fatigue. So that's what we are trying to alleviate for these people. Our solution is a yeast-free approach to healing. So let's talk about that. You will get a copy of this, so don't feel like you need to scribble it down, or you could take a picture if you want, but you'll get a replay of this, is we have to deplete the gut. So to heal, we first have to remove the obstacles to healing, and then we have to replete in the body what it is deficient in. So throughout the duration of what we call the yeast-free eating program, the yeast-free regimen, the yeast-free eating regimen, the Candida Cleanse, it's all the same thing. The following foods are going to be okay. And I don't need to read through all these, but essentially what you're going to notice is these foods don't have yeast, because we don't want to be putting more yeast into the gut, right? So we're going to be sticking with meats that are just very plainly cooked, and eggs, salads. Most veggies are going to be fine. Hard cheeses, so not all cheeses are okay. Your harder cheeses, your butters, avocados, citruses are okay. Some oils are okay. Black olives, coffee and tea, so you can have that morning pickup. When it comes to sweeteners, I'm going to talk more about sugar, but yeast feeds on sugar. I'll repeat that. Yeast feeds on sugar. So when you're hungry, you eat something, or you go looking for food to eat. When the yeast or the candida is hungry, it's going to do the same thing. Yeast feeds on sugar. So when you have sugar cravings, this is a really good indication that you likely have yeast. So it's not your fault you're craving the sugar, it's the yeast fault. That's why we need to get rid of the yeast. Apple cider vinegar is okay. Other vinegar products are not. Foods that need to be eliminated: sugars, artificial sweeteners. Also some vegetables that naturally have higher levels of sugar or get converted over to sugar faster, like beets, butternut squash, peas, and potatoes. Those simple carbohydrates that the body breaks down really quickly and converts to sugar. Soft drinks and some of the more obvious. Also, if you are consuming foods that when they are baked or cooked rise, they are going to likely have gluten in them. So if you're familiar with what some gluten-containing foods look like, you can pretty much cut all those out. And the reason I say that is this doesn't have anything directly to do with gluten. It's just that a lot of foods that have yeast are also foods that have gluten. So that's why I say bread and baked goods here. Also milk, yogurt, and soft cheeses, because the Candida will feed on that. And then we have our processed meats, mushrooms, vinegars, but also pickled products, and some foods or condiments that have vinegars in it, like ketchup, for example. Now, after 1 month, in moderation, you can reintroduce the following: fruit, brown rice, sweet potatoes, oatmeal yogurt. And then if you want to have liquor or alcohol, it's generally better to consume liquor that is low in sugar, and even better, that is distilled multiple times. So you might see triple distilled sometimes. So vodka is a good example of that. Of course, you don't want to add a bunch of sugar to that drink. But that's kind of a hack too, especially if you're doing this around the holidays or special events or birthdays. People say, well, I'd really like to have a cocktail. Okay, then this is going to be your best choice, because oftentimes this will last a few months. This Candida Cleanse will. So let's talk about depleting the gut, as we do that by eliminating out certain foods. After eating yeast-free for just 1 week, no medications yet. Let's say you start today, you eat yeast-free for a week based on what I just showed you here. After week 1, then we start introducing antifungal medications. So there are supplements that are available over the counter that help to deplete yeast, but not to the extent as prescription medications, which is where we come in as the pharmacy, which is why I'm talking to you about this. So nystatin is one of our top dispensed compounds. We do it for basically every guest that comes through. So it's a nystatin capsule, which is an antifungal medication. Also, this is very important. Of course, we have guests that you have the choice of, you can go to any pharmacy you want. You may be getting non-compounded prescriptions and compounded prescriptions. We're generally a fan of compounded prescriptions because we know exactly what's going in it. We can customize the dose, and we're going to get a cleaner, more pure product. But please listen to me when I say this. Nystatin that is commercially available at your retail store has sugar in it. And that's exactly what we're trying to get out of the body. So again, it's like at the beginning of this presentation, I told you we do not put hormone disrupting ingredients in our hormone creams. It's like, hello, why would we do that? But also, hello, why would we put sugar in our nystatin preparation? It makes no sense. So we have to say ours is compounded free of sugar, dyes, and parabens, which again are those hormone disruptors, because we do not want to feed the Candida even further. It's completely counterintuitive. Now, when you take nystatin capsules, it's going to pass through the stomach and into the gut. And the intention is to kill off the Candida overgrowth in the colon. So that's right before you have your bowel movement, right? It's the last thing there, the last place that the stool passes through, your food passes through. And so we really want to be sure that we're killing off the yeast overgrowth in that area. Now, the reason that we ask you to eat yeast-free for at least 1 week is that, of course, people's diets are on a spectrum. You may have the cleanest eater, meats, vegetables, gluten-free, no yeast already. That person is going to sail through this the very easiest. Then you have someone who is on a diet high in processed foods, high in gluten, high in yeast, high in sugar. After just 1 week of not consuming those high yeast foods, you're going to get natural die-off of the yeast. But if we give you an antifungal and we have you swallow that capsule and it passes through the gut, and you already have a ton of yeast overgrowth in your gut, you're going to feel real bad when you take these, because you just have a lot more yeast to kill off. So that's why we like to give a little bit of a weaning period to allow that yeast to die off. Now, all these instructions would be on the outside of your prescription bottle, but essentially we start low and we work up slowly. So for the nystatin, we have you start with taking 1 capsule with each meal 3 times a day. You do that for the first 2 weeks, and then you bump it up a little bit. Then you take 2 capsules with each meal 3 times daily until you finish that bottle. Now, they're the large bottles because you're going to get a lot of capsules. Now, most of our guests will go through this for 3 months straight. If that is true, you will probably get 2 bottles of the nystatin. In between there, sandwiched in between, we want you to take a 1-week course of fluconazole. So we do dispense this at Physician's Preference Pharmacy, but we do not compound it. If you've had a yeast infection or you've had other infections in the past, you've probably picked up diflucan from the retail pharmacy. This is the same thing. It's diflucan. It's just the generic name for that. And this kills off the yeast in the bloodstream. So if you've had allergy treatment at our center, or if you have been treated for that, then you understand that there's probably a connection between gut dysbiosis or dysregulation of the gut microbiome and allergies. And I can explain to you why. So we focus a lot on leaky gut at our pharmacy and at our center. Now, there are a lot of things that can impact the integrity of the gut lining. Again, our gut is like a tube, right? It's a lot more complex than that, but you think of it like a tube that your food passes through. And that tube is comprised of little itty bitty tiny cells that are strung together. But imagine that these are the 2 cells and they're supposed to fit very, very tightly. When you're stressed, whether that's stress at work, stress at home, stress in any part of life, or say that you're eating a poor diet and that's causing stress on the body, stress equals inflammation. And when inflammation happens, then we get weakness of those cells and then they kind of start to pull apart, creating a passage for toxins and nutrient particles that we do not want passing in and out. So when we get that leaky gut, where is it leaking? It's leaking from the gut out into the bloodstream. The bloodstream is supposed to be very clean or to be used to eliminate things out of the body. The body's smart. Its job is to keep you alive. So when it senses that there's something in the bloodstream that is not supposed to be there, it tags it. It tags it as a foreign object, and it doesn't take many times for your body to tag that again and again to go, okay, well, we're going to make an allergy to that. And that's how food allergies happen. So a lot of times when we food allergy test our guests, they're super surprised that everything that shows up positive on their tests is what they eat every day. And that's a perfect explanation of why, because it's leaking from the gut out into the bloodstream. So how does this come back to fluconazole? Well, fluconazole works in the bloodstream. Nystatin just works in the colon. But if you have leaky gut because you've had fungal overgrowth, you're going to be having leakage of nutrients, exchange of nutrients and toxins from the gut in between the gut and the bloodstream. So we want to be sure we clean out the bloodstream too. All right, and here's kind of just a schematic for how we deplete the gut. So we start the yeast-free diet. We eliminate simple carbs, like I listed on that slide with all the foods. And that's during the first week. Then throughout the course of the whole first month, no yeast, sugar, milk products, alcohol, or fruit. Start the compounded nystatin. Also, it's important to start a probiotic. I recommend over 4 billion CFUs, which is the units that we use to describe basically how potent a probiotic is. That's a colony-forming unit daily. And you won't hear this often, but please be sure to rotate your products, your probiotics every 3 months, at least every 6 months. You don't want to eat the same food every day. You don't want to put the same probiotics in your mouth every day for the rest of your life. It also can be helpful to consider a product from the vitamin store in the building called NutriCaps, which is a neutralizing capsule. Also considering something like Alka-Seltzer Gold with each nystatin dose. Here's why. So when we kill off the yeast dies off and it creates an acid. The acid can build up in the lining of the gut. It can be building up in the joints, for example. And what can happen is that can cause some discomfort. That's what we refer to as yeast die-off symptoms. However, if it creates an acid, what we can do is we can neutralize that acid with something like Alka-Seltzer or neutralizing capsules so that you don't feel the effects of that acid. It's also very important to increase your water intake throughout the course of this yeast-free cleanse because we are killing something off in your body. So we would love to flush it out just as fast as we're killing it off. You will be most successful that way. Then during months 2 and 3, if you do this for a duration of 3 months, you continue to avoid yeast and sugar. You can add some things back in sparingly, which again, I referred to on that slide listed with all the foods. Continue with your compounded nystatin. And then you take 7 days of fluconazole and then nystatin. So you eat yeast-free for a week. You start your nystatin, you do that for about a month. Then you do fluconazole for a week. Then you do nystatin for a month. So I've tried my best to simplify this out, even with pictures, to make it seem a little bit less daunting. So I recognize that these are very small, but I'll explain it to you. So I have a couple different blood work results here from different guests from a provider that did prescribe nystatin with us for his guests. So this is on the left-hand side, guest blood work before the yeast-free eating program and using nystatin, and then 60 days after. And so what we see here actually is we are looking at the area in red. So we can measure in the blood Candida albicans. In most of our guests, we actually don't measure the Candida because although diets that are high in processed food, people that are very stressed, people that have leaky gut, and all of those symptoms, we are going to know if they have yeast overgrowth, essentially. On top of that, even if you try to be the healthiest person possible, which is why I said this applies to everybody, you still, to a certain extent, are going to be breathing in toxins, breathing in pollution. You will be stressed at some point, and your body is going to take a toll on that because that's how it keeps you alive. It takes the brunt of it so that you don't, quote unquote, feel it. Okay. But it is still going to take a toll on the gut, which is why we ask our guests to do this Candida Cleanse once a year. But this still backs it up. We still like blood work to show us exactly what's going on. So we can test the IgG level of Candida albicans, which shows us that there's been some sort of an infection or an overgrowth. Here you can see it's red. Again, it doesn't really matter what the numbers are. It's slightly elevated here, but it's red, it's out of range, right? And then after 60 days, we come and actually we are able to drop that IgG level, that Candida albicans level by several points. We're in the black, we're now in normal range. Second guest, also blood work from somebody on nystatin. So again, we actually are pulling a IgA and IgG levels of Candida albicans here, both elevated and out of range. After 60 days on nystatin, we now see that we've dropped significantly, almost slashed by 2/3 the levels and brought them back into range here. All right, so I'm sorry if you are eating your dinner while you're watching this, but I have to show pictures because they make for the best before and afters. So we also compound something called an antifungal nail solution. This is a proprietary formulation to Physicians Preference Pharmacy. And there are a few different places that yeast tends to exit the body. One of those being the nail beds, and typically being the toes, probably because it tends to be one of the more moist environments as well. So you may be detoxing, to a certain extent out of the nails of your hands, but we don't very frequently see the effect of that, at least visually. But when you're wearing shoes, closed-toed shoes, summertime, especially in Houston, your feet can get hot, 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 and that's a breeding ground for bacteria and fungi, etc. So it doesn't matter if you are trying to use a nail treatment for some other type of fungus or bacteria or something. If you've ever gone to, let's say, CVS Pharmacy, for example, and looked for one of their nail treatments, it'll say on the back of the box, you should expect a 4-month duration of treatment. The reason why is our nails are quite resilient and they're quite tough, actually. And so it can be very difficult to penetrate the nail bed. So the reason that we dispense this antifungal nail solution in a nail polish bottle like this is because you do want to paint it on the top, but you specifically want to get at the base of the nail. And then you also want to go underneath the nail in the front so that it can penetrate. We use very specific ingredients, which is why compounding pharmacy is so awesome, is we can actually customize this in a way that helps to drive it in further. So we have antifungal ingredients in here, tea tree, urea, which all help to discourage fungal growth. And then we also use something called DMSO, which is a penetration enhancer. So when we use a penetration enhancer, it means that it drives the active ingredients, which is what I've listed here, into the place we want it to go. In this case, that would be the nail. So over several months of treatment, we see, and the lighting isn't exactly the same here, of course, but this is the same person's toenail. This would be before. And in fact, you see a lot of other ridges and discoloration in this nail prior, which is very interesting as it was affected by fungal overgrowth. And then this is somebody that we actually know personally. And so when I was speaking to the wife of this gentleman, she said, you know, we really should have taken pictures probably sooner because it was showing a marked improvement much before 6 months. But either way, you can see that there is a significant amount of improvement on that nail bed and healthier growth and texture after a 6-month period. All right, so again, a couple notes on the yeast-free regimen. So the duration of treatment depends on the persistence and severity of yeast overgrowth symptoms. So basically, how bad do you feel? Usually most of our guests go through this in about 3 months, but it's definitely a minimum of 1 month, which is why it's important that you choose a time of year that you can be consistent with it. Oftentimes, well, what we historically have seen when guests come into us for their very first visit, because they're usually starting on hormones as well, is they get very eager and they want to start on everything at once. For those that are hormone naive, meaning that they've never been on hormones before, they will start on their hormones and their nystatin all at the same time. And then when they experience any symptoms of yeast die-off, they tend to associate that with a side effect of the hormone. So to alleviate that, we like our guests to get started on their thyroid and their bias and progesterone or whatever it is that they may be getting on the very first day. Do that for a few weeks. And then we like our guests to start the yeast-free eating program at least 2 weeks into this new program. Because a lot of times when people come to us, they haven't been on any of the compounds that they're about to start. This is all brand new for them. So we don't want to misconstrue any of that. What happens is people choose to self-discontinue their medications or basically stop them on their own. And we don't want to misconstrue what's happening. We don't want to mistake yeast die-off symptoms for hormone side effects. Also, it's very important to use sugar-free nystatin. Please do not waste your money in picking up a nystatin prescription from your retail pharmacy if it has sugar in it. And that's important because we need to get the yeast out. That's the whole point. And again, topical nail treatment should be expected to last 4 or more months for complete resolution. All right, let's talk about repleting. So probiotics seems like a pretty obvious choice. This is pretty cool. I had someone approach me on Tuesday saying that their significant other had pretty much a debilitating vaginal yeast infection. Said she's bent over, she's in the fetal position, she can't move, she has so much pain. This is actually a perfect example. She was having a bout of allergies. She went to some primary care physician, I guess, who prescribed her antibiotics and steroids, okay? Antibiotics and steroids are like the cocktail for depleting the gut and increasing yeast overgrowth, and that's exactly what happened to her. Some people are more prone to genitourinary infections, so AKA that includes vaginal and yeast infections as well, and that's what she had. So significant other comes to me and says, oh my gosh, what can we do? What have we done? What can we do? I said, well, you need to tell her to cut yeast out of the diet. And also you need to get her a bottle of Saccharomyces boulardii like yesterday. So he got her a bottle of Saccharomyces boulardii, which is a probiotic that works against Candida, or it works against yeast. He said, well, how long do you think that this is going to take to help before she's really going to notice the benefits? I said, you know, I'm not entirely sure. Everyone's different, but give it a week. She needs to take it for 3 months because she needs to get a lot of that repopulated in her gut. But I don't know, maybe about a week. So he calls me today. He goes, oh my gosh, it's been less than 2 days and all of her symptoms are gone. So we love something that works super quickly like that. But in the case of this, if we're doing a full nystatin and fluconazole treatment plan, you should not start this until after you're done with the nystatin and the fluconazole, because the nystatin and fluconazole will conflict with the Saccharomyces boulardii, and we don't want them to be competing in the gut microenvironment. All right, I don't know if you're going to hear this anywhere else, so listen up to this. A note on probiotics and histamine. As a pharmacist, I was not taught this in pharmacy school, okay? I'm a big proponent of evaluating and taking an inventory of high histamine foods in the diet. It is a repeated problem that I see over and over and over again in guests, that some people may not have an issue metabolizing histamine. Histamine is something that's naturally present in a lot of foods. And actually, it's really important. It helps to keep the blood vessels open. It helps with blood flow. It helps in the inflammatory process in a good way. But when we get too much histamine, just like anything, we get something called histamine intolerance, meaning that we have been putting in more histamine than our body can flush out. Now, just like foods that we think are healthy, that sometimes don't match up with our body, there are many probiotics that we think are a good choice that are high in histamine. This is crazy, right? This is crazy information that we were not taught this, and it's not being yelled from the rooftops, because histamine can cause a lot of inflammation. So the bacteria that can be present in some of these probiotics can be histamine producing bacteria. So those bacteria that make up that probiotic may also increase your histamine levels. And a lot of times people can't figure out why they're not getting better. Now, the mast cells, which I've done separate lectures on, but the mast cells are a type of immune cell. The reason I list this here is the mast cells have several things inside of them that when the immune system gets set off, they basically start spraying like a skunk, just all of their contents they start spewing out. One of those things is histamine. So we do not want to aggravate the mast cells. If you have a probiotic on your shelf and you're wondering why your gut health isn't getting better, I encourage you to look on the back of the bottle and see if you've got these strains or these strains. So these strains here are ones that support the mast cells. They're going to decrease inflammation, help you offload histamine, and not contribute any more histamine to the problem, not putting fuel on the fire. I'll point out a few of my favorites, which would be Lactobacillus rhamnosus, and then also, of course, Saccharomyces boulardii. So Lactobacillus rhamnosus, Saccharomyces boulardii. I often also see that following steroid treatments and antibiotic treatments and COVID infections, that these tend to be people tend to be widely deficient in these. So of course we want to put back what somehow got killed off. So that's also another reason why I'm a big fan of those. And it's very noticeable. A lot of times you take probiotics, you're like, I don't really know if they're actually doing anything. These have been very noticeable for me. High histamine probiotic strains that you should look out for would be these ones that are listed here. Again, please rotate your probiotics every 3 months, at least every 6 months, if nothing else. So somewhere between 2 and 4 times a year. And you can find good combination probiotics, but I'm not always a huge fan of that. It starts to get a little bit dicey of what you actually have in there. So I have pulled several guests off of high histamine probiotics, so just please do keep an eye on that. Still inconsistent with the theme of repleting the gut, we have to repair the tissue. We talked about leaky gut. We talked about breakdowns on that tissue, inflammation, and stress. So again, whole separate lecture on peptides, but I'm about to give you the quick 2-minute version. Peptides are something that your body naturally makes on its own. Peptides are short chains of amino acids that act as signaling molecules in the body. So what does that mean? So peptides are made of amino acids. We get amino acids through foods. Our cells contain amino acids. We have millions of types of different cells and peptides in our body that are doing this 24/7 while we're awake and while we're sleeping. Now, just depending on how those amino acids are strung together, they make different types of peptides. And so peptides are very smart. They work as little messengers, a lot like hormones do. Hormones work as messengers to go to the brain, to go to the ovaries, to go to the testicles, to tell them to do certain things, to upregulate, downregulate, and peptides do the same. But peptides may span from improving sexual function to balancing the gut microbiome, to helping us fight off mold, to supporting the immune system, to repairing tissue. There are a lot of different types of peptides out there. So again, just actually even like with hormones, peptides are naturally present in the body, but with age, with trauma, with inflammation, with injury, those levels naturally decline. So what we can do is we can replace them with compounded peptides. And we have a large list of peptides that we compound at Physicians Preference Pharmacy. Now, some of them that are good options for gut health are two that I would highlight for you. One is PDA. You can remember it like public display of affection, but it stands for pentadecapeptide arginate. So this replaced one that we had on our formula previously, and then we brought on lorazepam, which we've seen not only help just for gut healing, we've seen it work in PANS and PANDAS for kiddos. We have seen it work in Hashimoto's thyroiditis to bring down those TPO numbers, which is the thyroid peroxidase antibody, and bring the immune system back into balance and decrease overall inflammation. So I'm going to just give you a side-by-side here because I literally could spend probably 45 minutes breaking down each of these peptides for you, but this is your quick and dirty version. Let's look at them side by side because these are both gut peptides. So PDA first. Reduces inflammation in the upper and lower GI tracts, works on muscles, tissues, tendons, and improves collagen production and inhibits prostaglandin pathways. So that's part of the inflammatory process. I didn't mention it on the last slide, but it's there. Peptides are very selective about their targets and their activation. The reason that's important is when a molecule has a very specific receptor it belongs to, they fit very well. And because of that, you don't have that molecule flying around the body, interacting with everything else, which is what causes side effects. So peptides are very intentional about the way that they heal us. We make this in a sublingual tablet, and we usually give one of these daily for maintenance. If someone says, hey, I recently had a round of antibiotics, or I underwent surgery, or I'm trying to come off a pain medication, something like that, we can front load them with more. So usually one sublingual tablet twice daily for a week or two or something like that, just to kind of give you a loading dose and jumpstart the body, and then back down to just one of those tablets per day. Usually we give these for about 3 months. Many systems in the body turn over in a 90-day period. So we like to set the expectation of a 3-month period. When I took the equivalent of PDA before, I took it just for 1 month. I had the intention of going for 3 months, but took it just for 1 month because my symptoms were resolved. So you can take it as long as you need it until symptoms are resolved. I have yet to have side effects reported with PDA. That's pentadecapeptide arginate. All right, let's move to lorazepam. So lorazepam is a peptide that decreases gut permeability. So again, we talked about that leaky gut. Imagine you're a billion times magnified, and these are two gut cells. They should be fitting very, very closely together. Now, when we get inflammation and stress, they start to break apart and get weak. But if we're looking at that at even more on a tissue and a filament level, meaning how these tissues fit together to make that tight lining and those tight junctions of the gut, lorazepam actually rearranges them so that we get a more favorable fit, and it keeps the nutrients and the toxins separate, so inside the GI tract and then outside in the bloodstream. So it basically retains that barrier. We also use this a lot in celiac disease. So part of what lorazepam does is when you eat something that has gluten in it, so let me back up. Celiac disease is the autoimmune version of gluten intolerance. Gluten is that sticky protein around many grains like wheat, barley, and rye. It's extracted from the grains and used widely throughout our food supply, usually as a thickener. So to hold things together like bread. We also see it a lot in condiments and soups to thicken. Okay. But for someone who has the autoimmune version of being very intolerant to gluten, so if they have celiac disease, that's now an autoimmune issue. What's happening is that when that person eats gluten, their body is releasing something called gliadin. Gliadin is what causes major inflammation in the body and raises levels of something called zonulin. We can measure zonulin levels, and it's a good indication someone has some major systemic inflammation going on. All that to say, this is really important for someone who has celiac disease because you can't live under a rock. You still want to be able to go out to eat. And a lot of people are worried about cross-contamination. So if they take lorazepam ahead of time, thinking they may get some cross-contamination with something that has gluten in it, it will stop the release of the gliadin, which causes the problem. So interesting how it works. So it's multifaceted. We make it in a couple different dosage forms, and it's more or less weight-based, so it's not exact. But we use this in kiddos. We also use it basically for people of any age, but it's more pertinent in those kiddos that are younger and lighter, that we will probably use the lower dose. Generally, we like to use twice daily dosing so we get coverage throughout the whole day. Also about 3 months. And then studies done on lorazepam have shown that there are no side effects reported with people taking lorazepam orally, but some what we call healthy subjects, so basically people enrolled in a study that were the control group, the healthy people that didn't have the issue that we were trying to treat. Some of those people actually reported headaches, which is interesting. So the ones that didn't actually need it are the ones that showed the side effects. Here are my references. And if you're looking for some more guidance, then you can go ahead and visit this website right here, which will take you to a link to Dr. Hotze's Optimal Eating Program. So this is a cookbook and more information on this eating program that will also give you recipes. So it goes by everything that I said about eliminating certain foods and incorporating certain foods, how and when to do that. But also if you want some additional guidance, then that can be very important as well. One other thing that I wanted to point out is it's just of timely relevance, is this past week, I attended a cancer conference called by the Beljanski Foundation. So the Beljanski Foundation focuses on integrative treatment for cancer, meaning that we take the best of modern medicine when we mix it with functional medicine and we blend it to have a multifaceted approach for patients that have cancer. One of the things that I learned there that I was not aware of before is how strong of an overlap we have of E. coli with cancer. Now, the gentleman that I was listening to lecture, Dr. Brian Ardis, you may know him for being the guy that is renowned for talking about nicotine therapy, is the guy that I was listening to talk about this. And so what he said, and this is not new information, is that many of the times in cancer, I have heard some specialists in the field say 100% of the time, but I'm not that specialist, so I'm not going to say that. But almost all the time, or all the time, when we take a biopsy from a tumor from someone who has cancer, they find parasites in that tumor. They also find heavy metals. They also find Candida and E. coli. So there is a lot of talk right now of the importance of addressing Candida overgrowth in everybody to help protect you, of course, against the development of inflammation, of chronic illness, and of disease, right? We're here because we want to be preventive. We do not want to be reactive. There are way too many things out there we cannot control. We should try to be as preventive as we can. So this is another part of encouragement for you. Also, what we learned is for those that received the COVID shot, part of the technology behind that shot, because vaccines are developed to work in a certain way. By definition, we know that that shot is not a vaccination. However, that COVID shot is designed to reprogram at a genetic level and control actually E. coli and Candida by the way that it works, so that the body cannot become as resistant to it. And that was what I wanted to share with you because it's relevant now and that was new information to me. So we have to be really intentional about the way that we detoxify, about the way that we clear Candida and heavy metals and E. coli and the other junk from the cells that we just simply don't need in there. Because if we have things in our body that we don't need in there, the body doesn't like that. It causes inflammation. Chronic inflammation causes dis-ease in the body. Dis-ease equals disease. So I think that that's something that's very relevant right now. I wanted to share that with you. So I really appreciate your attention and your time. Of course, if you have any questions, you can call us directly at the pharmacy. Our phone number is here. My email is there. Prescriptions are still required for the nystatin and the fluconazole to go through the yeast-free program, but I've gone over a lot. So if you have follow-up questions, please do give us a call. If you would like to have prescriptions for these items, then all you have to do is call your physician and ask them. If they do not know how to write these prescriptions, have them call us. We'll walk them through it, or you can call us directly, and we are more than happy to request that from your physician as well. And most certainly, if you are interested in being a guest of the Hotze Health and Wellness Center, you can easily scan this QR code, and we would be more than happy to get you set up with a complimentary consultation to see if you're a good fit for what we could offer, and it would certainly be our privilege to serve you. So I'm going to stop sharing now. And if we have any questions, I will be happy to take them. Also, if anyone has done this and they have any feedback or want to discuss their experience or benefits or side effects or anything that they have experienced, I would be interested to know that. But certainly this is something that we offer for prevention. And again, we do like to repeat it basically once a year, and that's from a preventive standpoint. We don't want viruses and bacteria or shots that we take manipulating these fungal overgrowths or bacteria overgrowths or heavy metal presentation in our body. So we want to be sure that we purge that out and always support cellular detoxification. So if I don't have any questions, then I will see you guys on the next webinar. And I think next time I'm going to be covering some information on parasites. So please be sure that you stay tuned. That also interplays with what we talked about tonight. We generally have a strong overlap with these pathogens as well as with parasites because they do all require a host, which means that they have to live off of somebody, and that somebody could be you, and we don't want it to be you. So if you've got questions, please reach out, but I appreciate you for showing up today, and I will see you next time.